Hello, everyone, and thank you for joining me again today for the Finding Hope After Loss podcast. It's officially September and fall will soon be here. I know I for sure am looking forward to the cooler weather and everything else that fall brings. I also wanted to take a moment to remind everybody that October is Pregnancy and Infant Loss Awareness Month. As I've previously mentioned, I do a reading of names for the Wave of Light on October 15th of each year. If you aren't familiar, the Wave of Light is when everybody lights a candle on October 15th at 7 p.m. in whatever time zone you are in order to honor all of the babies who are gone too soon. If you would like your baby's name to be included, please look for the post on Instagram or Facebook, or you can always send me a message on either one at Journey for Jasmine, or you can email me at Sarah, S-A-R-A-H, at journeyforjasmine.com. My hope is to always include as many babies as possible. I truly love being able to help honor and remember each and every one. So today I am talking with Caryn Rich, who went through infertility, 17 fertility treatments, 5 miscarriages, including an ectopic pregnancy where she lost a tube, and the child loss of one of her twins. Her journey has inspired her to become a fertility coach so that she can help other women who are navigating the journey of infertility and loss. Hello, everyone. Today I am here with Caryn Rich. Caryn, could you tell us a little bit about yourself?
Absolutely. Thanks for having me, Sarah. I'm so excited to be here. So I'm Caryn Rich. I'm originally born and bred in New York, but living down now in South Charlotte and loving life. I am a wife and a mother of 3 beautiful children, and I'm also a fertility coach.
It sounds like you have a pretty full life.
Yes, I do.
So what made you decide to become a fertility coach?
So that's a great question. And I would say that it, was something that happened for me. And that was my entire infertility journey, which was super long and started back in 2005. So I have been in and around infertility since 2005. So I feel like I call myself like an OG because I've seen so many changes happen, since I went through my treatments. But essentially, I went through 17 infertility treatments, 5 miscarriages. I lost a child. I lost one of my twins. I actually had 4 children. And it was a really painful journey for me. And with one of those miscarriages, I had actually had an ectopic pregnancy and lost one of my tubes. So after going through so much, I never thought, anything that we would ever have another child. But lo and behold, in my early 40s with one fallopian tube, I got pregnant on my own. So it was very healing for me, having gone through so many years of infertility and so much loss, to have actually conceived on my own, because you hear that happens to everybody, but that would never happen to me until it did. Right. So I was able to kind of sit, and I, in a former life, worked in the fashion industry, and I would oftentimes say to myself, it's not brain surgery. I'm not doing this big world greatness. And it wasn't until afterwards, I was very private about my infertility journey. There were a couple of friends and family members who knew, but overall, I was super embarrassed of the issues that I had, because to me, nobody else had issues and I was the only one. And, we tried to have, more children, and everybody was having their second and their third and their 4th children, and, not understanding. And I was stuck in miscarriage and failure. So after I had this natural pregnancy, it just kept sitting on my heart. Like, it was horrible what happened to me, but I have to do something with it. I have to be able to help other people through their journeys and show them hope and be that ray of light. And, I want to say it was roughly 4 years ago, I started, my coaching business. And it is so amazing, obviously everybody I work with, I want them to have a baby, right? I want everybody to have a baby, but it's not just about having a baby. It's about making that journey easier. It's about saving them money along the way. And then, yes, of course, it's about, having a baby, but oftentimes along that way, there's relationship healing that happens. There's more joy in the journey. There's more positivity. And every time I have a client say to me that one of these things has happened to them, it just makes me happy. Now, of course, I love getting, emails in the morning or text messages in the morning with a baby picture saying, hey, look who was born. That makes me happy too. But it's just being able to help and be that bridge between a medical team and the couple that just makes me so happy to be able to be there for them, because I think, as we all know, if we've gone through any kind of infertility and treatments, that it's super hard to get the support you need.
Yes, it absolutely is. And I love that you are that person for people. It's kind of somebody who can hold their hand and walk the journey with them and make it more than just, these are the medical steps to get pregnant.
Yeah, exactly. Because there is so much more. And when you're stuck in that cycle of loss and failure, like you start, it feels hopeless. It feels hopeless. And I know what that feels like. When I have clients who are deep down in the trenches, I understand, like when I say to them, I know that you don't think you can go on anymore. I was there. I get it. So being able to have somebody, and again, as I said, to be that ray of hope, because if I can overcome it, so can you. And that's what I'm there to help you do.
So I know you touched on it a little bit, but do you want to share a little bit more about your infertility and loss journey?
Yeah, absolutely. It was a really, really tough one. And you don't know what you don't know what you don't know. I think, for me, I'm not sure if all of your listeners, go through infertility treatments, but, even if you're not going through infertility treatments, when you have a miscarriage, it hurts. It hurts. That first one is like, okay, maybe it just was, a fluke thing, right? But then you have your second, and then you have your third, and then, you just keep having them. And you're just at a loss for words. And oftentimes, doctors just are not equipped, or especially even fertility clinics are not equipped to handle multiple miscarriages. And I'm here to say, to anybody listening who's had more than 2 miscarriages, any doctor who tells you that that's normal, it is not. In fact, I recommend that even after 1 miscarriage, you start doing some kind of testing, not the full testing, but I think as a person going through loss, you want to know that you're doing something to move closer to what your issue is and overcoming it. So for me, that's kind of what I did. I mean, it took me so long. It took me 8 years because I kind of fell outside that bell curve of having all of these miscarriages. And, I produced a lot of eggs, and it's just like, it was unexplained, which, side note, unexplained is not a real diagnosis. And I'm sorry to upset anybody by saying that. There is an explanation. The doctor just hasn't, dug deep enough to find that. But my loss journey just found me like with this resolve, with blinders on, to figure out what the heck was going on. Like, why was I, and I should add, my first IVF I ever did resulted in my first pregnancy, my first child that I have. So the second time around, I kind of thought, oh, it's going to be easy. And it wasn't. It was, 5 years, 5 miscarriages. It was disheartening. And then when you get that positive pregnancy test, it's not relief. It's not relief at all, because you know what can happen after you've had 1 miscarriage. So you're always looking for blood. You're always wondering all of these things. I mean, I won't get too graphic, but I was like a mess, even with my natural pregnancy. It's a big mind, like it just messes with you. It's a roller coaster. And sometimes it just takes everything that you have to put one foot in front of the other. But doing that and moving forward and making changes is what is going to finally get that viable pregnancy for you. But it just took me a long time to figure that out. I felt like, I had to do my own research. I had to do my own research because the doctors weren't helping me figure out what it was, what my loss was. Like, why was I continuously having loss after having had a proven uterus, as they call it? So it was tough. It was a lot of hard times. And, oftentimes, men and women go through loss very differently. And I don't want to leave a partner out of this situation, because when you're going through treatment or even trying to get pregnant, both partners, have feelings. But I remember one miscarriage, my husband had, was like I don't even know what number miscarriage it was. He went out to have to a bar with his colleagues, because that's how he needed to let off steam. And I was at home hysterical crying, and I was so angry at him. But in hindsight, everybody he was frustrated with the process too. So, this process of loss and having to go through all of these different twists and turns. It's almost like a flow chart. If then, if it's this, then you do this. And it's difficult. It's difficult. Does that make sense?
Yeah, that definitely does make sense. And I think it's a good point that you bring up that, unexplained infertility is not a real diagnosis.
Right.
Because you're right. I think they say that when they don't know what's causing it, but it has to be something.
Mm-hmm. And I've really ruffled some feathers by saying that. And I don't mean to hurt anybody's feelings, but in my experience, there is always a cause.
Well, to me, it's kind of like, they're finding, things in our DNA like every day. Mm-hmm. And, it may be something that they haven't found yet even.
Mm-hmm.
Right. So I think, and also, I think you bringing up that men and women grieve differently is also really important too. I know my husband and I, we were able to grieve together a lot, but we also do grieve differently. I'm more outspoken about it, and he's more quiet about it.
Mm-hmm. Yeah. And neither one is wrong and neither one is right. It's just how you grieve. Grief is grief.
Yeah. And even, even two women don't always grieve the same. You could go through the exact same type of loss and still have a different grief experience.
100%, 100%. And that brings me a good story, if you don't mind me sharing. I remember I was in a baby, a little kids group. My son was probably 1 or 2 years old, and he was in one of those baby classes, and I went to lunch with 2 other women after one of these baby classes. And one of the women was very vocal about the fact that she had just had a miscarriage and how upset she was. And when she went to the bathroom, the other woman who was sitting there was like, she just needs to get over it. And my mouth was it dropped open. First of all, she didn't know how many miscarriages I had had at that point, nor did she know whether I had miscarriages or not. And here it was, this woman who was convinced that anybody can get pregnant. She was like, I have this best doctor. She should just go to my daughter. Everybody's different. And I really I don't even know if I said anything. I don't know if I had the strength to even say anything. Maybe I did, maybe I didn't. But I just to this day remember how callous that was. Another woman pulling another woman down, not knowing, what her situation was, and then expressing it to me, not knowing what my situation is. You're right. 2 women go through it. And she had said, she was like, I had a miscarriage. And she was so flippant about it.
Okay. Well, that's not how we all experience.
No, right. Exactly.
But those kind of comments are why people are so, scared to talk about it.
Yeah. I have to say, Sarah, again, in 2005, the world was a different place. There was no Facebook, there was no Instagram, there was no community. And, I think I had one friend who had an equally hard time as me getting pregnant. And she was a huge resource for me. And eventually I found a doctor, who was an out-of-box thinker. And trust me, I lived in New York City, went to doctors in New York City, went to the finest doctors in New York City, some of the best well-known doctors who got famous people pregnant at the same time that I had miscarriages. And it was a small little clinic that they have the best pregnancy rates because they don't put you in a box. They don't put you in a box. And, to this day, I send clients there from the South down to there because, even in this area, sometimes, again, you go back to, it's not okay for a doctor to ever look at a woman and say, it's your body's fault. And I've had that said to me, and my clients have had that said to me. Yeah, so it is what it is.
Finding the right doctor is definitely key, but definitely hard sometimes.
Mm-hmm.
They're out there, but
they are
not always, like you said, not always in the big name famous doctors.
No.
So why do you think it's important to talk about your story?
Because if I can help one person who's listening to this and give them hope, then my day has been positive. And we as women have a fundamental right to have children like everybody else. As women, we all have a fundamental right to have a family should we want to. And it really, really gets me angry that there's this paradox here in the US. We'll cover, in certain cases, insurance companies will cover, plastic surgery, but they won't cover the treatment of, loss and infertility. And it just gets me angry. And every couple who wants to have a family, money should not get in the way of that. Resources should not get in the way of that. And, I myself, my husband and I, 17 cycles, if you do the math, you can just imagine what that did to our, everything, It's just, I want to be able to provide that hope and support because it's not fair. It's not fair that some of us, our journeys are not as, even and steady as some others. And I'm just trying to level that playing field. And listen, I am not here to say that pregnancy by any means for anybody is easy. I had a friend who would always say either getting pregnant, pregnancy, or postpartum, somebody has, an issue with one of those. It's not an easy road for anybody by any means. So I don't want to minimize that. And some have more than one of those, right? But like I said, I believe that we all have a right to have the family of our dreams.
I love that. And it's so true. And, we didn't go through IVF, but we went through other infertility treatment, and insurance didn't cover any of that. It was all out of pocket. And the whole time I was just like, this is so unfair. Like I didn't choose to have infertility happen to me.
No, you didn't. And I'm sorry, go ahead.
I was just going to say, and then, you get those comments like, well, you should just adopt. There are babies out there. And I'm like, okay, but I want my baby.
100%. It's so insensitive. It's like the top 10 things not to say to a woman who's having a hard time getting pregnant. It's so easy for them. And the thing about also, having to do infertility treatments, it just really bites that it's the only disease or for lack of a better word, I don't want to call infertility a disease, but it is a diagnosis. It's the only diagnosis that insurance companies will pay for the diagnostic piece of it, but not the treatment. That's like saying you have cancer, but I'm not going to pay to treat it. Like,
yeah,
what
it's ridiculous.
It is ridiculous. It really is ridiculous. And I had a very good friend of mine knew that we were going through all these infertility treatments, and I'll never forget we were hanging out with them one day and she was asking me about our journey, because I think people because it took us so long and we had so much going on and I did so many cycles. I was always cycling or losing or, people just didn't ask anymore. People get to that point where they just don't ask anymore because it's just old news to them. And I remember her asking me, and she was like, oh, I would never do as many cycles as you did. I would never. And I was like, okay, well, that's your choice. I said, but, this is something I want to do. And several years later, she called me up and she's like, I'm so sorry that I said those words to you because we're doing it now. And she's like, I understand.
Wow.
Yeah. So don't ever think that you know what it's like to be in somebody else's shoes. Even if you're good friends, even if you know somebody, friends, family, family means well, friends mean well. But sometimes you have to set boundaries and say, not your, this isn't for you to be discussing. And it's not, thank you for your opinion. Keep it to yourself.
I feel like most people are not trying to be hurtful. They think they're being helpful. And I just like to think that they don't understand. So they don't know the right thing to say instead of them trying to like intentionally be hurtful.
Yes, but I feel like if you are an evolved enough person, you know better than to even try to say I understand or to make a recommendation. Somebody who's evolved, and if, somebody's listening to this who, wants to support a friend or family member, the best thing that you can do is to just listen. Just let them talk. I think it's a natural
Absolutely.
human instinct to want to solve something, right? You want to help, but you can't. You can't. Like, unless you have a wand that's going to make this go away, you can't. So I think that all you can do is say, how I want to be here for you. I'm a good listener. I want to listen to what you have to say. How can I support you?
I think that's great advice. Really, when we had our infertility and our losses, that's all I wanted is somebody to listen to me.
Mm-hmm.
They didn't have to fix it. I knew they couldn't fix it. I knew I couldn't fix it, so it was nice to just have those people to just kind of vent to.
Mm-hmm. Right. They become your people, right? They become your circle. And oftentimes I recommend that you cut certain people out of your life who make you feel inferior or stress you out. Because as we know, Sarah, the situation is so stressful as it is, you don't need any more stress. And you don't owe anybody anything either.
Yes, that's absolutely right. I think we're afraid to cut certain people out. Like we feel guilty about it almost, like we can't do that. But
Mm.
taking care of ourselves is like the most important thing, but it's a thing we're kind of bad at sometimes.
Well, and then if you are doing hormones, you add that into it. But the whole situation really messes with your head. It's like you've got amazing highs and then you've got disgusting lows. And then you have to, meld, an action plan, between what two people want to do, right? Sometimes there's a different, plan of attack from each party, right? Like one may not want to move forward, one may like it's just the whole situation is so stressful. And it's not the only stressor in your life. So, you have to think of yourself. You have to think of your own self-care and you have to put yourself first. And you cannot feel guilty and you don't owe anybody anything. You just don't. I don't care if it's your mother, your best friend. You don't owe anybody anything. You got to be selfish and put yourself first. Because like I said, this process it's so difficult. And then you add, medication and hormones into that. Forget it. Forget it.
Absolutely. So, is there any other advice that you have for people who are newly going through infertility or loss?
Um, I would say that the biggest thing is to take a beat. I think sometimes when we're going through this process of having a baby, we just want to be at it every month because I think that way we feel like we're moving forward and doing everything we can. But I would actually recommend the opposite. I would recommend taking a beat, looking at the things that have already worked and then the things more importantly that haven't, and then what's missing, because that's where you're going to find the things that are going to move the needle most for you. And unfortunately, I've been saying that, the rate of infertility has been 1 for 6 for much longer than the WHO, announced that recently. There's so many infertile couples, X amount of infertile clinics. Everything is done through through the portal. Sometimes I have patients, clients who I work with who are not even getting phone calls telling them about, vital information like a pregnancy test. It's very, very hard. So you need to learn to be your own best advocate, and you kind of need to insert yourself in that situation with your doctor. Doctors are wonderful, but you need to do your own research and bring it to them too. You cannot rely solely on, the doctors today, because again, if you do not fall into that bell curve of loss or infertility treatments, they kind of just don't know what to do with you. So, don't be afraid to get a second opinion, and don't jump from, one trying cycle to another trying cycle without having looked at, what you've already done.
I can't believe that doctors aren't even calling people back.
Oh, it's awful. Like I have one client who I'm working with I have several clients who I'm working with actually who looked in the portal themselves to see that their cycle didn't work. And that's, upwards of $15,000, $20,000 that they're dropping. And to be made to feel like you're not part of that process when, I try to stop people and help them to explain, especially if you're going through IVF, and you're dropping all of this money, that you're paying them for a service. They, they seriously can't find 2 seconds to call. I just think the whole situation is messed up.
Yeah, I think so too. I mean, I've been on a smaller scale, I've been annoyed that, every time I call my kid's pediatrician that they never seem to call us back, but it seems to be a problem with a lot of doctors nowadays. I don't know if it's just
100%,
being short-staffed or, I mean, I don't know what the issue is, but it's like, why can I not just get a call back from anybody?
Well, the reason for that is going back to a bigger problem of the insurance companies. And the insurance companies dictate that you need to have X amount of patients a day to be seen. And imagine if you want to hold more than one insurance, at your practice. So I think that that is a bigger issue. I don't want to blame the doctors per se, because I feel like there are still really caring doctors out there, but they are encouraged to use this resource of this, portal to streamline the process. And I think that there's been this human aspect that has been taken out of everything that we do now, and it's become so mechanical and clinical. But yeah, even the pediatrician, it's like, what, you're not calling every single day. So if you're calling with a question, can you please call me back? Hello.
I know. And I brought it up to the actual doctor and she's like, you're not the first person who's told me that. I'm like, okay. But then when I tried to call again, a month later for another question, still no call back. So I'm just do my own research, I guess.
And it really sucks. I just did a talk. I was invited to do a workshop in a group last week. And I literally talked about this very topic of becoming, your own healthcare hero, how to advocate for yourself. And it was one of the things that I learned how to do through my infertility journey, but I use it to this day. I have a child with an IEP, a child with a 504. I have a child with, special needs who's had 65 plus surgeries. But I encourage everybody to learn this process of advocacy, because it really is something that you will use not only in your infertility journey, but with your children, with your own medical, journeys, with your children's education when you need to advocate for them. I mean, learning to be an advocate for yourself is just so important. And that's, I think, kind of what we do naturally for our children, because we have this kind of connection, but we need to do it for ourselves too, because it's really important.
Yes, you're so right about that. And that was something that I was really not good at. And
right.
I had to kind of learn it through, same through our infertility and our losses, that I'm like, okay, I don't have to stay with this doctor. I can go somewhere else. I can, I remember I have PCOS. And so I didn't have regular cycles when I was trying to get pregnant, which is obviously a problem.
Yes.
So I had heard good things about acupuncture, and I started doing acupuncture, and I saw actually really good results with it. Like it helped regulate my cycle. And I mean, I can't speak of it highly enough. It was one of those things that I thought, okay, I'll give it a try, not thinking it would work, but I found a lot of benefit from it. But I remember at the same time I was doing a fertility treatment, and one of the doctors, I told her that I had been going to acupuncture and that I thought it was really helping. And she just kind of like blew it off and was like, well, there's not really much scientific evidence to support that. And, I'm just kind of like, okay, but I've seen results from it. Why are you like dismissing me? It was just weird.
That is a nutshell of why I do what I do. Because you know what? There are so many other, don't even get me started, certainly in the last 3 years, I think that, there's been a lot of different medical things going on in the world. But, why do you have to knock something? It doesn't matter. I know lots and lots of women who have done acupuncture and it's helped them. And I know some who hasn't. But why does it matter? Was that necessary? Was that supportive? Like, I always feel like when you say something, you need to check yourself and be like, is this going to be helpful? What's coming out of my mouth? Is it going to be supportive? Like, and as a doctor, I mean, that's a prime example of it's just the lack of emotional support that I think you do get from a infertility clinic is astounding. It's just astounding.
It is. And especially during one of the most emotional times in your life.
Mm-hmm. Right. Is there anything else more emotional than wanting something so bad, but it escaping you every time? Like that's the thing too, is that, I almost wish that some of these doctors had to go through what we had to go through. Now, I actually had a doctor who went through what we went through and understands, and I love her. And to this day, like I still speak to her, all these years later. But it's very rare, and I think that makes for a better infertility doctor when you have struggled, when you know what it's like, because I guarantee you somebody who struggled wouldn't say to you, oh, whatever. Like, I don't think it's doing anything. There's no medical, like, because you just know that's not what you say. Just not what you say.
I know.
I'm sorry. I'm sorry that happened to you. I'm sorry. I'm sorry to everybody out there who has been told something disheartening from their doctor. I'm sorry for everybody listening to this whose infertility doctor told them that it's their fault, that it's their body, that, they're to blame. They waited to enough. I think we have to stop and we have to listen to our gut because it's not your fault. In this whole process, let's be honest, there's very few things that we can control, right? And you can only control what you can control, right? And again, knowledge is a part of that control factor because, I can tell you that every single person that I work with, and I say this with love, and I hope I don't come off as doctors are so important. Doctors are so important. But again, going back to this, they have limited time with you. There are things that are getting missed. And every single client that I've worked with for over the last 4 years, once we sit down and start talking about their history, we find multiple things that were overlooked. Multiple. I mean, I can't even begin to tell you. And it's just, and then I have these, clients going, I don't understand. I don't understand what well, you have to ask them that.
Right.
It's just like big things, like somebody has blocked tubes. And when you have blocked tubes and you don't take those out, it can cause infection and you could have multiple failures, miscarriages, all of the, how do you miss that? It's right there in the notes. It's right there in the notes.
Yeah, I thought that was like one of the main things they check for.
No. Not if you're doing infertility treatment, because they think, that it's not, but that's not true. Even if you have a strict, something needs to be looked into. This particular person was literally, when I met them, 6 months ago was about to do a cycle the following month. And I had to say to her in a nice way, can you just wait until we look through this? And then we uncovered thing after thing after thing after thing after thing. And she was just like, I don't understand. I'm like, I don't understand either. But all I can tell you is this is, when she went back to the doctor and said, he's like, oh, yeah, maybe we should look at that. What? Oh, yeah, maybe we should look at it. But they were ready to drop, another $35,000, to do a cycle and then to test the embryos and things. It's just, it boggles my mind because it's just, I want everybody to be able to get there as quickly as they can and not throw bad money, like, why should you I don't want you throwing money after something that's not going to work. And that's why I say, when you ask me that question, don't keep rushing into your next cycle. Don't keep throwing money at it. Because even if you're not doing infertility treatments, more than likely, if you're listening to this, you're on some kind of medication to help you with the losses that costs money. Stop throwing money until you actually have figured out what that issue is. Try to figure out what you've missed so that you can make that next cycle your best cycle. That's my, please do that. And again, I am not knocking doctors. I think they need help. And I think that they'll be appreciative of the help that you're finding things, right? You are part of your journey and you know your gut and your body better than they do. So I think that oftentimes there's this power shift that happens, right? I feel like, well, they're the doctor. They went to the schooling for this. I can't make a recommendation. That is the farthest thing from the truth. The farthest thing from the truth. And if you have concerns and your doctor is not listening to you, that is your first sign that you need to go find another doctor.
Yes, absolutely. And I also think, doctors can't know everything. I mean, there's a lot to know. There's a lot of medical things. And I just think, especially if you have something that maybe isn't as common or, I just think doctors don't know everything about everything. They don't even seem to know very much about PCOS, which is a super common thing.
I can't even begin to, I agree with you absolutely 100%. I had a friend way back who had PCOS and they weren't even giving her any kind of metformin or something like that, but she had to do cycles. She had to do IVF. And, I remember just having these conversations about, well, if you have PCOS, there's certain things in your blood that you need to kind of level out, but you're 100% right. And I think the other piece of it is too, Sarah, you brought up, the acupuncture. Why should that doctor care that you're doing acupuncture? But why is this doctor not recommending that you're on an anti-inflammatory diet that's going to regulate your insulin, right?
Exactly.
So why there's so many other questions that come up too. And again, this is why I do what I do, because doctors, the only thing that you're getting served with from your doctor is the medical piece of it. You're not getting emotional support. You're not getting support for your symptoms. You're not getting support for your mental health. You're not getting support for your nutrition. You're not getting support for, how do I get up and do you're just not getting that holistic, with a WH, right? You're not getting that whole support for the whole of you. And, it's just, it makes me, I get so upset when I hear these stories. And I'm sure, you doing this too, Sarah, I'm sure you hear these horror stories. You have your own horror stories. It's just, when somebody tries to tell you that what your gut is telling you is wrong, or that, you're crazy, or, it's so hurtful when it's coming from a medical professional.
It is. I mean, it's like they don't take you seriously. You feel like you're crazy. You feel like you shouldn't have said anything. That makes you, feel like you shouldn't try to advocate for yourself.
100%, because and then you won't open up your mouth again, because the last time you did, you were made to feel bad. But you know what? You don't have to stay in that situation. I have a client that I'm working with who went to a doctor, and literally this doctor looks at her and goes, "Do not do another cycle with your eggs. You're too old. It's your body's fault. Blah 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 blah." Well, when I tell you, when we found her the right doctor, they were whispering how many eggs they got from a retrieval because they were too embarrassed because they had so many eggs.
Wow.
It's just like she came out crying from this doctor's office because he made her feel like such a piece of you know what. And you have another doctor who's like, what were they talking about? You have a boatload of eggs. We just need to do this, this, and this. So that just goes to show with the right doctor, you will get the right results. It's just, I mean, I myself had, after I lost, one of the worst things that has ever happened is me losing one of my twins. And I had a very unusual situation when I was pregnant with my twins. I had an integral birth and the babies were fine. My doctor was negligent. I was funneling, meaning that my cervix started opening up prematurely because I had two babies, and I should have been on bed rest, but I'll spare you the details. But it was a very traumatizing delivery involving an ambulance ride of over 4 hours. I was on an island. It was a horrific, horrific thing. But I just remember, and I was on blood thinners for my immune conditions, and I remember waking up and I didn't even want to ask if I was still pregnant because I had to deliver, and just so happened to be that I was still pregnant with my daughter, and my son's placenta had to stay in because you can't deliver both. But anyhow, the point of my story is that this doctor blamed me. And then she was born at 23 weeks, spent 135 days in the NICU. This doctor literally blamed my body. It was my body's fault when he was negligent. My first child was born at 34 and a half weeks, which is a sign of an incompetent cervix. And then I have twins, and I'm telling you, and I'm complaining that I feel like they're going to fall out and you do nothing. But that's for another day. And again, so important to listen to your gut and to advocate for yourself. And had I, maybe I would have had a different outcome. But the point of my story is this doctor blamed me, told me I should never, ever, ever get pregnant again. I would never be able to have a baby to full term. And that if I did, that I should get a surrogate. Do you think the man was like eating his hat when I got pregnant on my own and carried this baby to 36 and a half weeks with the right doctor?
Just
talk about messed up.
That's just, it's awful. That's all
Terrible.
I mean, there's no words for that. Like, I just can't believe.
There's no words for it. There literally are no words for it. Literally no words for. So, again, that gut feeling that, you're listening right now and you're looking for something. That gut feeling, listen to that gut feeling. Always listen to that gut feeling. You know yourself and your body best.
So is there anything else that you would like to add or share?
If anybody is looking for any kind of resources, if you go to my website, carynrich.com, and you go to free resources at the top, I have a whole bunch of resources for you to check out, a whole bunch of blog posts. Feel free, to go through. And I hang out on Instagram a lot. If you have any questions, please DM me on there. It's just like my name, at Caryn Rich. I would love to, hear what you thought of the interview, or if you have, any questions or, private thoughts, I would love for you to do that. But other than that, I think I've really verbally vomited a lot here, Sarah.
Well, I want to thank you so much for taking the time to come on and, share your story and about, how women can really advocate for themselves.
Yeah. I appreciate you having me. I'm so glad that we connected. And I really appreciate you making a voice for us to be heard and, and making this topic less taboo. So thank you for that, Sarah. And thank you again for having me.
Thank you so much, Caryn, for sharing your story with us. One thing that you brought up that I find very frustrating as well is that women have to go through so many recurrent losses before doctors will even think about doing additional testing or trying to find a cause. Just think of all the losses that could be prevented if doctors would just take these losses more seriously. If they would just be willing to test for a few more things right off the bat. For me personally, it just feels like another way that losses, especially early losses, are dismissed as not being a big deal. Oh, it was just a fluke. These things are common. They just happen. You can try again. Yet how many doctors actually take the time to sit with us and tell us, "I'm so sorry. It's okay to be sad. It's okay to grieve," instead of just sending us away saying, "Come back when you're pregnant again." I had a miscarriage after doing a fertility treatment. I remember going in for the ultrasound, and my reproductive endocrinologist looked at me and said, "I'm so sorry," and told me it's okay to cry and it's okay to be sad. And then I couldn't stop the tears. And honestly, he wasn't a doctor I would have even expected that kind of compassion from. Not that he wasn't nice, he just always had more of a clinical, straightforward approach. But that moment meant everything. It gave me permission to be sad, and I didn't feel dismissed. And I truly hope he knows how much I appreciated that moment. And hopefully, if we continue to share our stories and to share our experiences, more doctors and medical staff will start to realize just how important language and empathy are. And hopefully it will inspire more to not be so dismissive of our heartbreaking losses. Make sure you subscribe so you don't miss any future episodes. Thank you so much for tuning in, and remember, we are all in this together.